Summer here, it's more important to protect your skin from the damaging sun rays. May is Melanoma Awareness Month, so what better time to have one of the top-rated dermatologists in the country here today. Please welcome Dr. Palm. Good morning.
Good morning, Brooke.
So we want to talk a little bit about how devastating melanoma can be and how easy it is to get this living in a climate like this.
Absolutely. Well, we know that the vast majority of melanomas are actually related to UV exposure, so that's why it's so important that San Diegans know about it, because melanoma can look like a really non-suspect spot on your skin, but we'll kind of go through some of the warning signs, A, B, C, D, E's, of how to spot them, and also I want to tell the viewers how they can get a free screening.
Okay, perfect. So what is it people should look at? Because obviously we have little beauty marks on our skin, and you don't want to become hyper vigilant, but you certainly want to know what's what.
Sure. So especially for people that have a lot of moles or family history of a skin cancer, you really want to check yourself once a month. And we have something called the ABCDEs. A is for asymmetry, something that doesn't look the same one half to the other. A regular border, that's B. Color, so if there's more than 2 or 3 colors. Diameter, so typically if it's larger than about 6 millimeters, which is like a pencil eraser head. But the most important one is E, which we added more recently, which means evolving. And that's just anything new or changing. If it itches, bleeds, it just seems funny to you, if it's the ugly duckling that doesn't match the rest of your moles, you want to get it checked by a board-certified dermatologist.
So what we're seeing on the screen right here, these have a bit of an irregular shape to them.
They do, and that's often the case. So if you notice something, and really commonly on the back, so make sure that a loved one is taking a look at your back. The back of the calves for women is another popular spot. These are areas that get a lot of sun exposure, and we're not watching. And if it's caught early, the earliest stage, it's almost 100% curable, but it really can be devastating if we actually get it late, because detection is really the only cure. There's some things coming down the pipeline, but for right now, you just want to catch melanoma early and get rid of it.
That's a really important point. So it's almost 100% curable if it is caught early? I didn't realize that.
Melanoma in situ, so when it hasn't gone through the first layer of the skin, is almost 100% curable, should be, with appropriate borders and surgical excision. But you know, as things progress, if things get into lymph nodes and blood vessels, then the diagnosis is more dire.
Okay, let's talk about the events you have coming up. We just had up on the screen, and we'll show that again, a fundraising party that you're having on the 7th.
Yes.
And also on the 2nd, you're doing free screenings.
That's correct. So we're talking about this. I want people to get screened. So this is the 5th year we've done it. On May 2nd, Saturday, 9 to 1, if you call our office, you can arrange for an appointment, and you get a free skin cancer screening. There's going to be 5 of us dermatologists doing it. Wow. It's the 5th year that we've done it. It gets bigger and bigger every year. And then to culminate in that, on Thursday, May 7th, at my practice, which is in Solana Beach, Art of Skin MD, we're doing a fundraiser from 5:30 to 8 p.m. We're going to have live music, fully catered beverages, silent auction. It's really great. We raised $20,000 last year. We're hoping to double it this year.
And where does all of that money, the proceeds, go to?
All of it goes to the Skin Cancer Foundation. So this is where we do research and where we alert the public as to melanoma and other skin cancers.
Perfect. Thank you so much for sharing this with us. We're going to have you back on the 10 p.m. show tonight because there's so much more to talk about. Thank you, Dr. Palm.
Yeah.